Immunisation is a global issue because viruses don't respect borders. Keeping children safe in another country keeps us safe as well. We're a very interconnected world. My name is Rathi Guhadasan. I'm a Global Health Policy and Advocacy Advisor at Save the Children UK. Some people don't like the fact that children can't tell you what's wrong with them, particularly the very young. But I actually really enjoy that part of practicing medicine and trying to figure out what's wrong and learning to recognise the different ways that children communicate with you at different ages. Children are extremely resilient, and watching a sick child recover from an illness is one of the most rewarding things for a doctor. When you engage with a child, you have to smile, you have to make big eyes at them. So even if you're exhausted, if you're having a bad day, when you're with the child at the bedside, you have to be present for that child. I was a clinician for a very long time, and at some point I started to realise that certainly for me, treating one child at a time wasn't enough. I was seeing, the same conditions again and again, vaccine-preventable diseases, diseases of poverty, and sometimes the same children again and again with the same conditions. And I felt that I wanted to work more systemically, and in a way I felt like moving more into the policy space could help me make a difference. I always used to say that this child didn't die from sepsis or pneumonia or diarrhea. They died from poverty. They died from, lack of roads, lack of transport infrastructure, a weak healthcare system that doesn't go anywhere near them, a lack of political will. And when I went to work in Laos and Cambodia, I found that children would come very late to hospital often, and I kept seeing children with preventable diseases and also diseases that were easily treatable if patients could present early. And I started to realise that the problem wasn't so much the medicine, it was the access. And then that started to change the way that I think about medicine. It's not just about what I can do as a doctor or what we can deliver in a hospital or a health facility. It's about whether the child or the family can actually get to the facility in the first place. In many countries you have to pay for the care, and even if you don't pay for the care, you have to pay to get to the hospital. You have to lose a day's wages. But also because they're poor and because they have to make these horrendous choices about coming to hospital or coming to the health centre, very easily treatable diseases can end up killing a child just because they came too late. That's not really the fault of the parents, because they're put in impossible situations of having to choose between, food for the whole family or just trying to raise the funds in order to get to the health facility. In the UK, there's a fairly good infrastructure in place. You may not notice it, but you get reminder letters, you go to the GP, you get your vaccines, everything's recorded. When you think about some parts of low middle income or low income countries, that infrastructure can be very weak or in some parts not existent at all. Families may not even know about the immunisation schedule, and they may not find it easy to go to the health centre on a regular basis. They may have a low level of understanding around health and children's health. And often the data systems are missing. So the children who most need to be counted, the children who are most likely to be malnourished, who are most vulnerable to these infections, who live in the most kind of infection-prone settings, they're often the children who are the least likely to be picked up in data systems. But at the end of the day, whether you're living in a deprived part of London or the northwest, or you're living in a low-income country, every child has the right to have vaccines that prevent these potentially fatal illnesses. In the UK, we seem to be going backwards. Recently, the UK lost its measles elimination status for the second time this century, and we are seeing now pockets of outbreaks around the country, and similar, that's mirrored in Europe as well. Those are worrying developments, and they are brought about by low vaccination rates, but even in high-income countries, they don't necessarily hit children equally. It's often, you know, pockets of the most disadvantaged areas where you might see outbreaks, for example. And it does show how easily we can lose it. You know, we make these amazing gains in terms of public health, but we can lose them so easily. The first misconception about parents who are worried about giving vaccines to their children is that it's a problem of ignorance. And I've been guilty of this as well, that you think that, well, if I just educate them more and throw lots of science and data at them, then they will come round to my way of thinking. But actually, so if you think about the UK, these parents are often quite well educated, you know, and have made great efforts to inform themselves. And it is just that one can become overwhelmed with the amount of information that's out there and the different sources of information, some more trustworthy than others. So I think the first thing is to recognise where people are coming from, and that perhaps this is an issue of trust more than ignorance. Your instinct to want to question this, you know, is a natural one and is a right one in a way. It's coming from a place of love. It's wanting to make sure you're doing the right thing for your child, and everyone can understand that. You know, good science also means asking questions. What I would say is that it's good to ask questions and it's good to want to find out more information, but I would ask you to think very carefully about who would be the best people or places to get that kind of information from, and do they have the right kind of expertise to answer honestly to your questions. So think about, for example, your local paediatrician or your local GP or somebody like that who you can go and ask questions to and hopefully get answers. After all these decades of vaccination, I think what we can say is that the data behind vaccination is robust and vaccines are safe. And from a personal perspective, what I'd also say is I have sat with parents whose child has passed away from a vaccine-preventable disease, such as measles or tetanus. I've not met a child who's passed away from a vaccine. I think the one I've heard most often is something around a natural immunity. So rather than giving children vaccines which are seen as being artificial, we should let the child develop natural immunity. Now, the problem with that is, first of all, not all diseases give you lifelong immunity. So there are some diseases that if you get them and you survive, you will have lifelong immunity. But there are other diseases, like tetanus, for example, where you can get it again. So that's one of the problems with the natural immunity story. The other problem is, of course, that if you wait for a child to get sick, they may not recover in time to build up that immunity, and they may end up, you know, fighting a very dangerous infection that could, you know, be life-threatening or leave them with life-altering complications. Measles is often understood as a fairly benign childhood illness with a fever and a rash that the child just has to get through it. But unfortunately, measles comes with a whole raft of complications, some rare, but some fairly common. And that can include potential blindness, it can include impacts on the brain, and it can include death. And the other thing that measles does is it affects your immune system. So even in a young child, even the immunity that they've built up to other diseases may be lost for a time. And even after the child is recovered from the measles illness, they may remain vulnerable to other infections for a long time. And in fact, some of the complications of measles that make children so sick, it may not be the measles itself, it may be a secondary infection that they've got because their immune system's been compromised. So even in this country, even in a healthy cohort of children, measles can be very dangerous. Immunisation is a global issue because viruses don't respect borders. Keeping children safe in another country keeps us safe as well. We're a very interconnected world. Zero-dose children essentially are children who haven't had a single dose of vaccine. In the world at the moment, there's about 14 million of them. A child who hasn't received any vaccines is probably also a child who maybe their birth wasn't registered, maybe they've never had a health check in their life, maybe their mother didn't have antenatal care. If you look more broadly, these children are more likely to be out of school, and often their parents, particularly the mother, may have had little or no schooling as well. These children can be the most marginalised, and they're disproportionately represented in conflict zones, in displaced communities, in marginalised communities, in remote rural areas, but also in pockets of urban poor. So if we can bring vaccinations to these children, we actually bring health systems to these children, maybe for the first time. To vaccinate a child, you need a working system, you need a trained health worker, you need supply chains, you need cold chain, and you need health data systems that can record children and can track their vaccination rates. So once you've reached them with that system, that's a great entry point to then think about other systems that they might need, for example, around nutrition or other health services, education, and so on. Immunisation is probably the most powerful tool in global health. Immunising a child is not just protecting that child, it's helping to protect other people in the community as well and build up what we call herd immunity. In communities, including in conflict-affected communities, Save the Children is helping make sure that the most marginalised children, those zero-dose children that we were talking about before, are not left behind, that they do get access to vaccines. And they also look at building trust in the communities, they look at training health workers, helping to deliver the vaccines. At the policy level, we're involved in advocating to governments around funding for immunisation, so particularly through Gavi, the Vaccine Alliance. So last year, Save the Children advocated in this country to the UK government and in other countries as well through the Save the Children teams to ensure that Gavi was refunded for the coming years. And that's really important and really welcome that countries like the UK again committed to funding Gavi. We know that Gavi works, it's been very, very effective in delivering vaccination. But we also know that we're living in a time of funding constraints for overseas aid, and that's affected immunisation as much as anything else. When funding is constrained, it can be tempting to just roll out or expand your existing programs. And the risk with that is the zero-dose children, the children who are left behind, may not be reached by simply expanding existing programs. So what I would say is you have to keep zero-dose children at the heart of the agenda, even when it's harder to do, when it's more expensive to do. We are living in an increasingly fragile and turbulent world. We have more conflict, we have a rising climate crisis with more children on the front line of that. And so if we don't keep focusing on zero-dose children, particularly in that kind of fragile, conflict-affected settings, but also in those marginalised areas that I was talking about in more stable settings, then we're going to go backwards in terms of immunisation. Although this is a moment of concern and potential vulnerability for immunisation programmes, it's also a moment of great opportunity. Gavi, the Vaccine Alliance with Save the Children and other partners, we know what works. And so they are in a great position to roll out those programmes at scale and reach millions of children.